Okay, so I know you came in to the clinic today because you have plantar fasciitis on your foot. And so all I'm going to be doing today with you is I'm going to be doing some range of motion testing on your foot. I'll just have you move your foot in some different ways so I can get some measurements if that's okay. And then I'll also be doing some like manual muscle testing just for your calf muscle in the front of your leg, just to see how strong you are dealing with the plantar fasciitis. I know it's like some inflammation in the fascia on the bottom of your foot. I know it can be pretty painful. Um, so to start, I'm going to be measuring some dorsiflexion on your foot, which basically means how far you can bring your toes up in the air. And so to measure this, I'd be on the side of your leg, just right here. I'll put the middle of this goniometer we use on your lateral malleolus, or this little bone right here, kind of going up to the fibular head. And then it'd be parallel to kind of your fifth metatarsal down here. And so I'll have you bring your toes up as far as you can. Perfect. Okay, let me see your measurement, which is 8, which is within the normal range for dorsiflexion, which is kind of 0 to 20, whatever that would be. So that was good. So now we're going to be doing what we call plantar flexion, which is just the opposite. We're pushing your toes kind of down into the ground, just like that. Perfect. So I'm going to be doing the same thing. I'm going to be coming over here to the side. You can have your foot resting right now. Then I'll line it up, and then if you don't mind, I'll have you push your toes into the ground. Perfect, just like that. And then, yep, so 30, which is pretty normal. You know, the range is kind of 0 to 50, so that's pretty good with your plantar fasciitis diagnosis. So now we're going to be doing some inversion and eversion, just kind of moving your foot like this way and this way. So if you don't mind, we'll have maybe turn the chair to the side real quick, just so we can kind of see. So for inversion, I'll just have your leg like that, and I'm going to be doing the same thing. So just some measurements. I'm putting the middle of my goniometer kind of in between these bones right here. The malleolus is going to be right here. The stationary arm will be kind of going up the middle of your tibia, like middle of your patella right there. And then this movable arm will be kind of following your second toe right here. So we're just going to be inverting. So I'm going to have you move your foot like this when I ask you to. So you'll be in neutral, just like that. All right, now I'll have you turn your foot in. Good, perfect. So the normal range is 0 to 35, and yours was 33, which is really good degrees. And then now we're going to be doing the opposite, which is eversion. So you're just going to be moving your foot kind of in this direction. Yeah, so I'm going to put my goniometer here, and then now I'll have you go out. Perfect. Just like that. All right. And then the normal range is 0 to 15, and you got 20, so that's pretty good. So not much difference there. So that was the range of motion we'd be doing for your ankle, for the tarsal joints is what we'd call them. So now I'm going to be doing some manual muscle testing for your leg as well. And I'm going to be doing the muscle kind of on the front of your leg. So if you don't mind, I might have you bring your pant leg up, if that's okay. So I'm just going to kind of check the strength of what we did earlier, bringing your toes up in the air. I'm just going to kind of just test the strength of this muscle right here, and seeing kind of how it feels on the bottom of your foot, because I know that's where the pain would be. So I'm going to be placing my hand here, and so I'm going to have my hand here. And so if you don't mind, I'll have you bring your toes to the sky and just hold it there. Good, perfect. Now you can rest. So now I'm going to have you do the same thing this time, except when you get up, I'll apply some resistance and try to push you into the ground, but don't let me do that, okay? So you can come up and then just hold it there. Hold, good, perfect. All right, so now we're gonna be doing, I'm gonna be testing kind of your calf muscle in the back of your leg, because it goes down to the heel, and that's kind of where the pain is. So if you don't mind, I'll have you stand up next to the chair, to the side. Yeah, perfect. And you can hold on to the chair just for some stabilization. So what I'm gonna be having you doing is we're gonna be kind of standing up on our toes, doing some heel raises, bringing it off the ground. And you're gonna, once you stand up, Good. We're going to hold it there for a few seconds, and then you can go back down. Good. And we'll do that again. And hold it up. Good. Looks like there's a good strength in your calf muscle as well. So perfect. That was the range of motion and manual muscle testing for plantar fasciitis.